Welcome, welcome, welcome. This is the Second Opinion Sports Medicine Podcast. I'm Dr. Dhokal.
I'm Dr. Glass.
Dustin, what is happening, man? Happy 2024, bro.
I was just going to say Happy New Year, brother.
Yes, we are here. It has this year gone by fast for you?
Yeah, it went really fast. I'm looking forward to 2024, though. Got a lot of good energy going into it, so I want to just keep the momentum going.
Yeah. Yeah. What was a holiday like for you before we jump into sports medicine stuff? How was your break? You got a few days off, I hope?
Uh, I got the days off of the Christmas and of the New Year's Eve, and then or New Year's, and then worked the days after. But it was good having family home. My daughter was home from college, so that's always nice having the whole family home. So we didn't really travel anywhere or do anything because her being home, she just wants to kind of stick close to home since she's never around. So
Yeah.
yeah, we were homebodies, but it was good. Lots of movie time, lots of family time. Yeah. So, what about you? Did you travel? Did you go anywhere?
A little bit. Just had a busy end of the year, and then my wife got a little bit under the weather, got a little sick for a couple days, so we just kind of nested out, recovered for a few, and then we did get out of town. We went out to Las Vegas for a couple days, made a Disneyland day trip one day. I got to see you the day after that, so that was
Yeah.
very nice to stop by the office. So yeah, we got a couple days off,
Yeah.
a few days to kind of unplug and reflect on the year and think about the year to come. So I always think that's nice at the end of the year.
Yeah. Perfect. A little reset and go.
Yeah. Besides podcast goals, any goals or any thoughts to changes in 2024 for you?
Yeah, a couple goals. I want to start and finish my book. I want to the guitar. I want to start picking up the guitar, and I got a ukulele. When I got sick, my mother-in-law got me a ukulele, so I'm gonna start working on that. Start working on uh, really figuring that thing out. So yeah, and harmonica too. I want to pick that up again. Those are both things I started during COVID to kind of get my brain going and to get my lungs going, and I just want
Yeah.
to carry that over and kind of really get have that be part of something I want to accomplish, along with the book, along with a couple other business adventures with you, and yeah. What about you?
Um, Man, just primarily work and personal health related. I would say
Hmm.
making a little transition with work this year, and so trying to make that smooth. Trying to grow and expand the business this year. Those are both goals. On the personal side, I just want to get stronger and stay healthy this year.
Hmm.
So um, I've had a lot of patients in this last year, which might be worth discussing, who are in their 40s or 50s or 60s, and in my opinion, too young to start having breakdowns, but have started to have bodily breakdowns. Like, man, I'm having trouble walking. I'm having trouble putting on my shoes or socks. My balance is terrible. And so, being in the profession and seeing clients come in and have these problems that they didn't have 5 years ago or 10 years ago, it really makes me want to be proactive to my own health. I had knee surgery. I'm not as strong as I used to be in my legs. It just makes me reflect on my health and how I want to be, not in my mid 40s, but maybe my mid 60s, like 20 years down the road. How do I want to be able to move? How do I want to be able to function in my day to day life? And then rewind that to like, well, what the heck do I got to do today to ensure that down the road, I'm not walking around with arthritic knees or a sore back or just having issues. So I've just been tripping out on that a lot, bro. I guess maybe that's just part of being middle aged, I suppose. I mean, what are your thoughts on that?
Yeah, no, I think we all kind of start reflecting on that, whatever you want to call it, midlife, not crisis, but just start going, okay, what's the next chapter look like? And with all the technology out there and with all the research out there and all these kind of fad things coming through, things that stay common are, um, breath work, working on our getting as much oxygen in our body. So I think that's important in this longevity world. me and you've been doing PMF, and I've been doing hyperbarics. We've been working with lasers. We've been doing all kinds of things. It all comes down to oxygen and mitochondrial activation of things, and that's how a lot of this longevity stuff works, right? So things that we can control, kind of daily habits. Start your day off with a big glass of water, right? We've heard that one, but that's so
Yeah.
important for the brain, right? If we got to keep our brain healthy as we age, right? So, and it's never too late to start. The earlier you start, the better. But start your morning off with a big, tall glass of water, whether you're thirsty or not. It's not about being thirsty; it's about rehydrating that brain. Yep, good boy. Yeah, I got my tea here, and avoid the things that
Yeah.
dehydrate, right? So, because a lot of people start their day off with coffee thinking, oh, they got some liquid in there, got some water, but then that's pulling away, right? So we're putting ourselves at a disadvantage right off the bat. Other things, so, and I work on breathing, work on gratitude. There's tons of research on how working on gratitude first thing in the morning will really jumpstart a lot of those healing properties in our body. So water,
Hmm.
breath work, gratitude, meditation first thing. But another one that I want to implement that we've been doing for a long time. I started a long time ago, but kind of falls away. But getting back to doing something cold first thing in the morning. There's
Yeah.
tons of research with that for the brain to help clear out those bad proteins that clog up the neural pathways of our brain. It helps with repairing the tissue. And a lot of, like, I talk to my patients about that because the cold plunge is coming around where it's becoming very popular, right? But we've been doing ice
Right.
baths forever. But now it's becoming kind of cool to do cold plunges. But I talk to my patients, just start off by doing cold shower in the morning, and they're like, "Oh, I can't do that." Well, you can start off by doing baby steps, right? So, like, take your normal shower, and even if you don't shower in the morning, start just getting your body going. Could be a few minutes, right? It doesn't have to be a full blown shower if people don't want to shower, but
Yeah.
do it for the discipline of getting in there, get going, get your blood going, and then slowly crank down the temperature to where it's starting to cool off. And over the next couple
Right.
months, get it colder, colder, colder until you are actually doing the full, 3 minutes or whatever you want to do of max cold, just to shock the body. And there's a couple places on the body that if you hit will help stimulate that brown fat, which will actually help with the metabolism and the healing properties. But like the base of your neck, underneath your armpits, the
Hmm.
groin, the small of your back, those places that make you. And if you look at from a survival standpoint, when we hit cold water, what do? We look up and go, take a few deep breaths, and that type of breath
Right.
work is actually helps stimulate the vagus nerve, helps stimulate all kinds of great properties to get that survival mode again. There's a reason why we do that, that breath to stimulate a lot
Almost
of
like a gas.
Yep, exactly. And by design. So if you can re-simulate that or simulate that every morning and start that repair and recovery mode, you're just dumping in tons of good hormones, tons of good recovery things, and it just becomes a discipline, right? So if you just keep doing it at any age, doesn't matter what age you are, and even if you're older, you can slowly start doing that where you just drop the temperature a little to where your brain goes, this is not my norm, this is colder than I'm used to, and you start practicing getting uncomfortable with that and allow your body to adapt. So I think even for people just starting off little things like that in the beginning of the year and start making the discipline of those three or four things I just mentioned are huge in this longevity world that we can control, right? We don't need we don't need to go out and purchase a bunch of stuff. Those are all things you can control on your own and do on a regular. So just a couple tips.
Yeah, no, I think that's good, man. I had somebody just the other day ask me, this was during the break. Um, a friend basically reached out to me and said that he felt last year was just Groundhog Day. He's like, man, it was a grind. I feel like I wore myself down. I let my habits get away. I haven't been going to the gym. And he was like, I just need to jumpstart, And so we were talking about things that he can do in a very compressed schedule. Um, and so honestly, I kind of know his setup and situation and said, dude, I think the simplest thing for you to do is get up in the morning and have some honey lemon tea or have some water with some mineral salts. There's a brand called Element, LMNT, that I use. It has like flavored salts, I mean.
Mm-hmm.
Um, so I mentioned, you start with some salt water in the morning or some honey lemon tea is what I like. I have some of that right here before
Mm-hmm.
every podcast. Um, and he doesn't have like a workout type of situation at home, but he does have some dumbbells. And I said, it's hard to squeeze in a workout, but what if you just go in your backyard and just say, hey, I'm going to do 50 reps, 5 sets of 5 or 5 sets of 10. That
Mm-hmm.
takes 5 minutes, 10 minutes. And his response was, bro, I don't even know if I have time for that. I got the kids, I got this, I got that. And I said, how about you just go out with get up in the morning, pour your water, go outside, do one
Mm-hmm.
set, just do one set just to activate, get the body used to that habit of in the morning, I'm pushing a little weight. And then maybe in February or March, you can get up to 5 sets, but just start with one set. So,
Right.
our kind of protocol for him wasn't very much. It was like water or tea in the morning, first thing, just to hydrate, hit one set outside. And then, I made the shower recommendation. He was asking me about cold plunge. He has a cold pool, he has a hot tub. I said, bro, I would just jump in the pool, and
Yep.
just jump in the deep end and then just get
Mm-hmm.
out. I
Yeah.
wouldn't even go down the steps from the shallow end and
Yep.
slowly torture. So I just jump right in.
Mm-hmm.
And he was kind of like, it's a little reluctant. I said, man, when you take a shower, then just exactly what you said, just turn it down, just get used to it. So I think that's what he's going to start with. And honestly, that's what I started with. I'm cold adverse. I don't like the cold. I'd rather be in 110-degree temperature than 30-degree
Mm-hmm.
temperature any
Yeah.
day, really, for real. And so when I started doing more cold kind of exposure, it was tough for me. And I still don't, totally cold plunge. Like we went to Vegas this weekend, we had a tub. I took a hot bath, bubble
Yeah.
bath, like the whole nine, was like warmed out, had a
Yeah.
cocktail, was living.
Yeah.
And I
Nice.
had the thought, should I fill this thing up with cold water and just jump in it? And I kind of chickened out and was like, nah, I want this comfort.
Yeah.
So I didn't do it, but that's a way to start. And I've had clients ask me, what kind of cold plunge should I get? And I said, well, do you at least take cold showers? And the answer is no. Like people want to purchase the thing
Yeah.
and go all in, which is fine if you have the money or you want to. But my recommendation was start with cold showers. If you can end your shower cold or turn it down
Yeah.
gradually to where all the way cold doesn't bother you, that is progress. And
Mm-hmm.
then if you have a tub, maybe go from there and just turn on the cold water and just submerge yourself in just cold water. That'll be
Right.
50 some degrees. It's not 32 degrees, but
Right.
I'm telling you, if you can't get into a cold tub, like with just the water on cold, don't even bother buying a cold
Right.
plunge. Like
Yep.
start with that.
Yeah.
Um, and so it's not a lot, but it's something. And I think that that's a great way to, I don't know what to call it. I call it kind of a reset. It
Mm-hmm.
just jump starts your day a little bit. So
Yeah. I
I
agree.
could be better at the cold plunge aspect of it, but the other things I think are valuable, man.
Mm-hmm. Yeah, no, I'd like to see more people start working on that cold stuff. There's just so much good research on that. I mean, like I said, at any age, obviously, you got to make sure your heart's okay. But that's something that everybody can kind of practice. And again, it's that practice of getting used to being uncomfortable, right? And letting
Yes.
the body adapt. You want to keep challenging your body. If it's always comfortable, then when it is exposed to something that's uncomfortable, if you don't know how to respond or your body doesn't know how to respond, it flips the switch too far too fast, right? So if you can train
Yeah.
your body to get used to being uncomfortable on a regular basis, it will be more apt to survive when it needs to. So just a recommendation for people. The other thing, like you mentioned, the trying to another good thing is to try to lift something heavy every morning, right? And that could be
Mhm.
for a lot of people just their body weight, right? Like we talked about the
Sure.
other podcast with Corey, is just like get used to getting off the ground, pushing yourself off the ground. That's one thing you asked what
Yeah.
I did start. Besides a couple reading things I'm doing every day, but also I'm challenging myself to have the discipline because it's not necessarily hard, but 100 reps a day of squats, sit-ups, and push-ups. So again, I
Great.
have 24 hours to get it done, right? And I'm not telling myself I need to do 5 sets of 5, 10 sets of 10, or whatever. You know
Sure.
what I'm saying? I'm just saying I need to accomplish 100 of each in the day. Well,
Yep.
it's been more challenging. I've done it every day, but it's more challenging than you would think to get it done. And so, but I'm
I
trying to
bet.
work on the discipline of, even if I'm exhausted at night, get down on the floor and finish my sit-ups. It might be 20 or 30, my
Yeah,
push-ups. And the push-ups for me could be from the ground, it could be from the wall, it could be from the counter. I'm just doing presses, body
sure.
weight presses throughout the day, getting my hundreds down. But again, I want to really challenge myself, kind of like the 30,000 step things, right? Or the 10,000
Hmm.
step thing. You're just trying to get your 10,000 steps in a day. It's more challenging for people than they think, right? Just to have that discipline of
Yeah.
getting it done. So for me, like you were talking about, I'm just kind of working on some more mental disciplines throughout the year. Yeah.
It's a good thing to continually kind of, at least for me, I feel like it's a good personal challenge,
Mhm.
like it's almost like I had a friend tell me in high school one time. I asked him why he was so, diligent with what he did. And I'll never forget this. This was in high school. So, years ago. He said, I figure if I can't keep a promise to myself, then I can't keep a promise to anybody else.
Wow.
And so he
That's
said,
powerful.
anytime, yeah, man, he said, anytime I want to do something, I tell myself, I promise myself I'm going to do this. And that's his commitment to himself, and I always remembered that was, just an important thing, and it's nice to stretch your limits a little bit or test your discipline. I
Mhm.
think it's really easy. There's this voice in your head that tells you to not do something or be lazy. I used to run track, and you have a lot of thoughts when you're running,
Mhm.
a lot of spare time, a lot of thoughts of, man, you can slow down or you can quit or you should stop or you should rest. And there's something that I really like about having this dialogue in my mind and uh, telling that voice to shut up,
Yeah.
and kind of push through it. And so I think there's value to that in other aspects of life, Um, on the cold plunge tip, Dustin, do you have any age restrictions? Like, would you say somebody who's, you know, 10 or 15 is too young to do that? Or do you think that's really going to carve in some discipline and carve in some, awesome habits, forget the health benefits, but do you think there's an age where you're too young maybe?
Yeah, I have not seen any research on any of that, so I don't know, but I don't think so. Again, you do it
Hmm.
age appropriate, right? Um,
Right.
like this New Year's, my daughter texted me from a sleepover, and she's 15, and she said, "I started my year off with a cold plunge," and I guess at the house she
Oh,
was at,
sweet.
they had one, and everybody did it, at midnight, So I thought, man, that's kind of cool, but
Wonderful.
yeah, but they, the parents obviously, instilled that in their kids, and I thought that was kind of cool. I think, especially if parents are in that mindset and they're doing it and they have younger kids, again, you can do it like you said. Start with the cold, the tub, just turn it on cool, even if it's just
Mhm.
room temperature, but it's colder than their normal
Right.
bath. You can start getting that training in their head that this we're doing this for a purpose of health and wellness, not just for comfort, right? And then that just
Yeah.
turns in over the years for these kids, to where it's just super normal to do it. And then typically kids like to do what mom and dad are doing, so they're going to start trying to
Right.
push the limits and show mom and dad that they can do it too, and they actually surprise you by being able to do more than we think they can. So I think from a physiological standpoint, I don't see any reason why somebody younger couldn't do that if they're healthy, to a certain degree, right? And then as far as
Excuse me.
as far as older population, the biggest thing is just making, if they're in good standing health and their heart is strong and healthy, I don't see any reason why. You just want to be able to make sure that somebody doing it can handle the shock value, so, but we
Sure.
just know so many good
Maybe the best
physiological.
way to
Yeah,
maybe the
go
best way to do that is to just take the gradual technique, room temp water, slightly cooler, faucet control,
yeah,
and just reduce it.
yeah. I
That
like
might be a good way with a younger, older population.
Yeah, like our parents, like we keep talking about, wanting to, instill in our parents that, even because we have the knowledge and their generation didn't do anything like this. So if we can pass that on and start making them, understand the benefits just from a Alzheimer's standpoint, dementia standpoint, brain health standpoint, right? Then their joints, stem cell production, if we can have them and figure out how to implement it in a way that is easy for them to implement, that'd be rewarding for us, right? So that's that's what I would hope.
Yeah, it's never. I don't feel like it's ever too late. Forget cold exposure or anything else.
Right.
To if it's a health improvement thing, I think the body responds. I've shared with you before about a patient who's in her late 70s now, and she started to take up cycling, riding a bike in her late 50s. Um, Man, she goes on 50-mile rides, 70-mile rides. These days she doesn't go much above 50 anymore, but she used to
Hmm.
go on like 100-mile, whatever you call those, not marathon races, but like endurance kind of rides,
Yeah.
and in her 70s. And I was asking her, have you always done this since you were like 20? I met her later on in life, and she said, no, I took it up in my 50s. And it makes sense. She started gradually,
Yeah.
a couple miles a day to 5 miles to 10 miles. She really enjoyed it. She said, I was in my thoughts. It was good for my body. And so it just really, I remember thinking, man, it's never too late, which
Right.
sounds very cliche, but it's really true.
Yeah, for sure.
And also on the kid thing, one last thing is I really feel like, not having kids, my assumption is that that would really be like a self-esteem builder, no different than making free throws or having success on exams. I feel like if you do that with your kids and encourage them and they're like, man, dad, it's cold. Like, I don't want to do it. And then they do it and they do it for 30 seconds and the next time for a minute. And then, they improve it. I feel like that has to be a self-esteem builder as well. Don't you think?
Yeah, for sure. And it's those little touches that you can do as they grow up where at the moment they're not thinking of their self-esteem, right? But what happens when later on they're set with a situation or put in a situation where they have to draw on something that's uncomfortable and in their brain and I actually talk to my kids about this like when they do something difficult, I'm like, "Hey, let's
Hmm.
bottle this up and remember this so when you are approached with something else difficult down the road, you can pull off this experience knowing that you can accomplish more than what you thought you could." And so that's how we kind of talk. That's how, me and my wife kind of talk about it with our kids. So it's not, so it doesn't get lost. Right. So, cause it's real easy to lose it
Right.
in the moment. And then, but if we call it, what we talk about is always practicing in the moment because it's not always easy, right? But when you're set with a situation, every time you're set with a situation or presented with something, take the moment to learn from it and grow from it at the moment, right? And then draw on it for the next time you experience. You might not be very good at it right now, but the next time you're approached, you're going to be that much better. And then the next time, even that much better, right? Your continual growth. So, yeah, so that's what we talk about in regards to the self esteem and the confidence of being able to accomplish more than you think you can. So you're right on. Those are moments that you want to expose, in my opinion, you want to expose your kids to or the younger generation to so they can pull on it later on in life.
I think what was important that resonated with me with what you said right there was just in the moment making that recognition, right? And being like, hey, you did this right now. Or it reminded me of a lot when I was coaching football, we'd lose sometimes. Well, actually, early on, we lost often. And it's like, what do you say in those moments where kids are down or you just got shellacked by somebody? You want it to be a learning moment or something that they don't forget. And so, you know, you remind those kids like, hey, remember what this feels like. We put in a lot of hard work. We came up short. We want to improve on these things. And then later on down the week during practice, you reflect on that if they're dogging it, like, hey, we don't want to have that same experience we did last week. So we need to be sharp here. We need to focus and reflect back on that previous thing. So, um, yeah, it's not something that I really reflected on until you said it. I think it's important to bring up those moments, right?
Mm-hmm.
When you're
Yeah.
in those moments and say, hey, this is a moment where you had some success or this is a learning moment because we didn't accomplish what we wanted to, but let's see what we can take from it, you know?
Yeah. Yep. Exactly.
Man, your kids are lucky to have have you guys as parents. I feel like just from your mindset and your work ethic and your drive and stuff, like I think you're right about kids learning by example and by witnessing what their parents do, you know? And so I think it's really cool that you kind of practice what you preach to your patients, you know, or at least do your best. It's hard to be doing everything that we speak of, but man, I commend you for that. It's not easy.
Yeah, well, I give credit to my parents. You know, it's kind of gets passed on, right? So, like, hopefully, my
Right.
kids recognize some things, and it's been fun over the years. You know, my kids have said, "Hey, I did this, that, and that." So, see, I am listening to you. You know, and so it's kind of rewarding when they get older. They're actually realizing that, man, I normally wouldn't have done that, but that's dad coming out or mom, you know. So it's kind of good. But I give credit to my parents. My dad introduced me early on to Dr. Wayne Dyer, and I kind of grew up with
Mm,
Wayne Dyer's teachings, and you know, he did that through business and all, you know, the books on tape and stuff, and then I was doing books on tape, and then I just continue that, and it's just constant, you know, just learning from different teachings, but it all comes back down to no matter what you're listening to, motivational, you know, success stories, a lot of it comes back to faith, and regardless of which religion you're, you know, following or believing, you know, if you don't have something to draw back on in the troubled times, it makes life a lot harder, right? So you know, a lot
right.
of it is, you know, just trusting in the process, and having faith that, you know, there's something more powerful than you to help get you through a lot of situations. And you know, you can implement that in business and life and relationships, whatever, and you can do it in a religious way, a non-religious way, you know, but it's all coming to that
Hmm.
common understanding that, you know, we're super grateful for the opportunities, and just please give me those opportunities and let me maximize on them, and you know, things like that. So yeah.
Dude, I think that's well put. I mean, the most you can ask for in sports is the opportunity or the chance to win.
Hmm.
And I used to frame it that way for the kids I coached is don't be afraid of the moment, you know? You
Right.
want to at the end of the game, you want to have the opportunity to win the game.
Right.
And so maybe that's a big moment, fourth down play or a big shot, but I really tried to encourage them not to look at the pressure of the shot, but look at it like, man, what an opportunity to win. You know,
Yeah.
when you're in the pregame locker room speech, you're just like, man, if we get down to it at the fourth quarter, 2 minutes to go, and we have the ball, we're going to execute and we're going to win. And you want them to visualize that and start to kind of think in that way. Um, I had somebody a few weeks ago while you were mentioning that, it reminded me we were just having like a discussion about how do you know if something's going to happen or you're putting in all this work and what if there's not the outcome and you're putting in all this input of effort and energy and desire and there's no guarantee that this thing is going to work out the way that you want it to, you know?
Right.
And I said, well, I guess that's kind of where faith comes in, right?
Hmm.
And then it turned a little bit philosophical and he said, well, I don't I'm not really religious like that, you know? And so I paused and I didn't really mean it in a religious way like that's where faith comes in.
Hmm.
But I could see, you know, a lot of times you think of faith as who do you believe in as like a higher power or things of
Hmm.
that sort. And really what I meant more was faith in yourself, you know, self-confidence.
Hmm.
And so I explained that and it was just a different perspective to him and he said, yeah, I'd like to think I can execute on this, but there's no guarantee that I'm going to. I said, dude, there's no guarantee that Steph Curry's going to hit free throws, but he has a 90 some percent rate of execution, you know? And so you just have to have confidence that most of the time you're going to execute and then also be okay on the times that you don't because you did the best that you could. Right. And so I think back to like golf or certain sports situations. That's why I'm okay with failure is because in that moment, I'm giving it my best shot and I'm what's the word? A little bit disconnected to the outcome, which sounds wrong, you know, like I definitely want to make the putt. I definitely want to execute and make the shot, complete the pass, all those things. But you know that you're not always going to, and so you have to be okay with sometimes failing, right? And just knowing that, hey, this time it didn't work out, but next time it's going to. I didn't do anything different or wrong. It just didn't work out this time, you know?
Right.
And so it was interesting to have this discussion with someone who's basically our age, and it was in the context of um, fighting, training. He's a jujitsu guy and is competitive with it. And I said, there's, I think the best athletes in the world train as hard as they can, prepare the best that they can, put forth the best effort they can, and then the outcome is the outcome. It's either you win or you learn, right? I think
Right.
that's a pretty popular saying, and
Yep.
I, it's something that I really live by. What are your thoughts on
Yeah.
that?
No, I love it. We call it failing fast, so, for those times when it doesn't go your way. Nobody goes into a competition or a fight, thinking they're going to lose, right? They're going into it
Right.
going, I'm going to everybody wants to win that competition, right? You wouldn't compete if you didn't want
Yeah.
to win, but there's only going to be one winner. There's only going to be one spot on the podium, really, right? You're either at the top or you're
Yeah.
not, so
Yeah.
there's the other places on the podium, but nobody goes into it looking for second or third, right? And if you
Yeah.
are, you're not in the right mindset. Even the underdogs hoping to turn something around, right? So
Let me let me ask you, who lost in the Super Bowl last year?
who lost in the Super Bowl? Oh man. Um, oh, was was it Bengals? Who was in it? Was
Dude,
it Kansas City and Bengals?
exactly,
Yeah.
exactly my point.
Yeah.
No, it was Kansas City and the Eagles,
Okay. Oh shit. Yeah, the Kelsey Bowl. Yeah.
the Kelsey Bowl.
Right.
But even with the Kelsey Bowl, right? You know Kansas City won it, but like
Yeah.
who lost it?
Yeah.
Like who knows?
Yeah. Yep.
Um,
Good point.
it's interesting.
Yeah.
I want to switch gears here real quick, Dustin, and talk about a couple things. I know you had text me a couple different NFL topics that were on your mind. I have a patient case, an NFL client who is having some stingers, and so I wanted to talk about stingers in general with you. Um, what's your experience with that? Is it only football that you've had experience with stingers, or other sports as well? I was curious when I was thinking about him and wanting to talk about it with you.
Yeah. Well, personally, I played baseball and football. I got a lot of stingers in football. I don't think I got
Mm-hmm.
any in baseball, but my neck was so messed up with football, and stingers came very easily. So I can
Mm-hmm.
imagine I probably had a couple in baseball, just being put in bad positions. Um, but yeah, they're brutal. And it's funny because you're bringing that up. With my fantasy football, we were trying to. I was in the championship. I actually won my DraftKings the bowl. I won the whole thing. I forgot to tell you that. Man, yeah, me and my dad won it.
Hey,
We won it last week, and it came down to the last like 5 minutes with our roster because we had we had Purdy going, and my dad brought up a point saying, you know what, he's coming off a week of having stingers. He got pulled out of the game the week before with stingers. I'm a little nervous that if he takes one bad hit, he might not be able to finish the game. And then I started looking at, man,
sure.
they're in the playoffs. Their number, they're up at the top. They don't need to actually play him. So if he has any so we ended up pulling him with like 5 minutes before the game started, and we put in Stroud. But anyways, because of stingers, and my history with stingers, my initial thought was once you've had it, you're going to be able to play it. It goes away within minutes to hours. You're pretty much good. It's not going to be an issue. But they didn't need him for that game. So if he had any inclination, they were going to pull him. So, anyways,
Right.
but yeah, stingers are a bad deal. For people that don't know what a stinger is basically you got this plexus of nerves that come out of your cervical, your neck, and I picture them like five hoses, garden hoses coming
Hey,
out, right?
Dustin,
Yeah. What's that?
I'm going to let you continue with that explanation. I
Okay.
have to just step away for a second to plug in this laptop, but
Yep.
go ahead and explain that out. Sorry to
Sounds good.
interrupt.
Yeah, no, you're good. So basically, there's like five hoses, water, garden hoses going to the lawn, right? And the lawn in this case would be our muscles. So you got sensory nerves and motor nerves coming out of your neck. So there'd be different types of garden hoses for different jobs, right? But you got five main ones coming out of this plexus, and as they come through the plexus or area, there's different places where those hoses or nerves can be pinched off or trapped. And so the first place is there's muscles in the neck called the scalenes that the nerves kind of pierce through, and the scalenes can sandwich those. So that's one place. And then as they exit that, they go between two bones, the first rib and the collarbone. So then the nerves kind of pierce through that. That's another place they can be trapped. And then the next place they can be trapped is the pec muscle and the subscapularis underneath one of the rotator cuff muscles. So you get just coming right off the neck, you got basically three or four spots where it can actually be pinched by several
Yeah.
structures. So what happens is with that kind of injury is when the head gets hit from the side and it gets whipped, and you put a quick stretch on that area, and then the nerves can get pinched in any one of those locations, and then you have symptoms down the arm, into the neck, down the arm, into the hand, even of either numbness, tingling, burning, weakness, depending on which part of the
Yeah.
nerves are being touched. So it's an instantaneous quick, it feels like a burning. Typically when I've had them, it's a burning type hot nerve pain that it
Yeah.
hurts, and it limits you right away. So yeah, so it's no fun, and
I've,
it's scary when
I've
it happens.
described it as being, dude, super scary. Any athlete that's had that, I mean, most of my experience with it is with football players. I've had some jujitsu, I almost said players, jujitsu athletes.
Athletes, yep. Yeah.
Yeah. Jujitsu participants
Yeah.
have that same issue. Um, I've had it described as like a combination between a toothache and hitting your funny bone, like that same electric kind of nerve pain,
That's a good.
shock. Burning is definitely a symptom of it. Um, I brought it up because this particular athlete has had a neck procedure. So he had a neck injury. Um, he's had neck problems for a couple years. He's had stingers throughout his career. He's played in the league, double digits over 10 years. And so he's had, probably a couple concussions, probably some neck compression issues. He had a procedure last year where he had a discectomy. And so he sat out some time and basically used the whole off season to heal. So the beginning of the season, he felt good. He felt strong, better than ever. Pre-surgery, he was having a lot of distal symptoms, weakness in his hands, symptoms down his arms. Had the discectomy and all that went away. And he was super happy, felt strong as could be to start the season. Well, the season started in September and now it's December. And he's had a couple incidents where just on contact, he's like, not even like I ran my shoulder into somebody to make a tackle, but just he's meeting somebody at the line of scrimmage and he's having symptoms be recreated just from that. He said one time he went helmet to helmet with somebody, like just face mask to face mask, and he said my neck kind of went backwards like this when my face mask hit his face mask. And he's like, it wasn't even a hard contact. It was just I'm going up to meet somebody. And he's like, my neck went back and immediately my whole left arm went dead and stinger, like the shooting pain. And it was alarming for him. I could see the concern in his face. So, at the end of the season, he'll make his decision on if he's going to continue to play or not. But have you had experience in someone who's had a neck procedure and continues to have stingers? Because I have my thoughts on what the next steps should be,
Yeah.
but what are your thoughts on recovering from that? And what would you do if you had an athlete that had that situation?
Yeah. So they determined, from what you said, that part of his stingers were coming from the cervical neck at the actual exit site from the spinal cord exiting
Right.
those foramina, right? So the foramina
Hmm.
where the nerve exits out of the bony area of our spine is a little hole, right? So that was getting narrower from, sounds like, the disc. So if the hole where the nerve exits is narrower because the disc material is pushing into it, then the solution would be, let's get rid of some of the disc, the discectomy, to open up that hole so the nerve can slide in and out easier and not have an issue if it
Yep.
gets contacted. Well, they did that thinking that's the main source. He felt instantly better. So the correlation would be, oh, perfect, I'm fine. But then we forget, because the surgeon, if in our brain, we feel like it's very like taking our car into the mechanic, remove this part and my car's fine, right? But then we forget that the
Sure.
body doesn't work that way. There's all these other avenues that I just talked about that could actually be entrapped. We just talked about 3 or 4 other areas that could cause those same exact symptoms that were not addressed with that discectomy, right? There, he
Right.
could have had an old collarbone or AC injury, and now he's got calcium on that area that makes that groove, or that area between the collarbone and the first rib, narrower, right? So which you
Narrower.
won't
Yeah.
feel until, and that actual hit, that face mask to face mask contact will take that scaling and press into that collarbone, sandwich that instantly, right? So that's another thing that we have to
Yeah.
address. And then as it goes down the arm, there's actually 9 different spots that can be entrapped for that median nerve part of the brachial plexus. That's just one part of that nerve plexus, right? So think about, so
Yeah.
we would work up that chain from the distal area up, trying to clear out areas to give them some longevity and say, hey, let's clear out all these spots, not just the one area where it felt like, and give you some, longevity in your career. I think it's,
Yeah.
unless it's, unless we see spinal canal stenosis or IVF stenosis that's bony and the surgeries are off the, but if everything anatomically looks clean, then I'd say let's go to the mechanics and start working on getting that first rib articulation. Because a lot of times that first rib articulation from the back of the neck, and we're not even thinking about that because it's all frontal and arm, but getting that first rib
Sure.
articulation and movement so it doesn't pinch on that collarbone, that nerve, that alone can start making a huge difference. And then I start looking at that six scapula kind of dyskinesis where the scapula is not moving and the rotator cuff not moving to affect
Hmm.
that whole area. So again, we start getting that
We had that.
moving.
Yeah.
It opens up a whole lot of life for that area. And it's like, man, you just saved me. Now I'm playing another 3 to 5 years when I thought I was done, so that'd be a nice case
Yeah.
scenario, right? That paints a nice picture. There's obviously other factors that go into it. So it's not as easy as that makes it sound, if it was that easy, it
Yeah.
would have been cleared out already, right? But
No, you're right though. But those are, as you said that, there's a couple things that I think at our next treatment I need to revisit.
mhm.
One of the things I was going to mention was, since he's had his discectomy, he hasn't had a cervical adjustment or like an upper thoracic adjustment. So, the supine cervical adjustment, we're just doing traction and tissue work. He's a little apprehensive about getting that adjusted. So, we listen to our patients. He doesn't want to get it adjusted. We let it be. Now, sometimes if somebody's apprehensive and I really have a strong inclination that, hey, this is going to help you, and there's, a very, very, very low probability of anything getting worse, then I will try to gain that patient or client's trust and say, hey, let's try to get some movement in here. I feel pretty confident this is
Yeah.
going to help you. Because of how he's felt, particularly that day, we didn't adjust him. It felt very kind of stiff. I wouldn't say so much inflammation, but just, he had the procedure almost a year ago. So it feels like it's really kind of gotten, I don't want to say scar tissued out, but
hmm
become very restrictive in movement. So even prone, doing like a modified, diversified kind of upper T adjustment side to side, he was like, I don't know. Like, I'm kind of like cautious about that. So it was just a contact and a stretch, a contact and a stretch, nothing to really get an adjustment in that area. And part of me really felt like, man, I want to open this up and get some movement here where it's stiff. His cervical spine felt very
Yeah.
compressed, like he was wearing two helmets instead of one helmet. So
Yeah.
we tried to
That's
just
suboccipital.
open that up a bit. But as you describe that, I think the next time I see him, we did spend some time anteriorly on the shoulder, the collarbone, the pec, trying to get this. But there's a few things that I think I might have maybe missed that I could spend some more time on the next time. We were also on a time limit. It was pre-game, on a Sunday night game. So we had about 55 minutes to work, and I would have liked about 90 minutes to
Yeah.
work. So we did what we could.
Yeah.
But those are good things for me to think about, man. I appreciate you bringing those up because you're right. There are multiple points all the way distal.
Yeah.
And maybe the next step is to try to clear that out distal to proximal.
Yeah. Yeah. No. And it's like you just mentioned, and I know what you meant by it. It's like, and it's easy for us to say, oh, I might have missed that. But, like you just said, in the moment, you didn't miss it, right? It's not that we miss it. It's just like we only have so much time. So you got to go with what's going to be the best for that moment. And then, then we
Right.
regroup. So it's a perfect opportunity to come back and say, okay, well, we know how that, I got a couple other areas. And, yeah, that's I would also work like costo transverse that area, doing that anterior adjustment on that shoulder, coming from
Mm-hmm.
the front, because that way you get a lot of that thoracic movement without him feeling nervous about that neck. I know exactly what you're talking about.
Yeah.
Also having what you said where it feels compressed, that trap at occiput, I would follow that trap all the way. Like you can adjust all the way down to like T7 T10 area and release all the way up to that,
Right.
because the way the lower trap attaches down there, and then it won't even be close to his neck, but that it's releasing that upper suboccipital because of that attachment indirectly, right?
Sure.
So, and then I would,
Yep.
as his body gets more comfortable, work up. But yeah, that and lat, I would do that. There was one other muscle I was going to say to think about. Uh, but yeah, I don't know if you use much of the instruments, the activator, some
Mm-hmm.
guys are, don't like it, or don't, they think it's hokey, but you're like, hey, listen, I'm just going to use it. This is to stimulate your muscles, right? Because that's basically what it's
Yeah.
doing. We're using the muscle spindles and Golgi tendon apparatus, and we're just kind of stimulating. So we're not even talking about adjusting the neck, right? For people that think it's really hokey, I just talk to my athletes about, yeah, I know what you're saying. It's just like a flick on your neck, but I'm just going to stimulate and put a quick stretch on these muscles, get them to relax so the bones can move easier, and then we know it's
Yeah.
doing what we want it to.
You know what I say about the activator, Dustin, when
Hmm.
people are like, what is that little stapler, that little
Yeah.
clicker? I describe it like knocking the rust off. I said,
Hmm.
you ever had to unscrew a bolt and that thing's been bolted for a long time? What do you have to do with it? You can wrench on it. It doesn't move. I mean, what do? You spray some WD-40, maybe you loosen it up a little bit. You're knocking the rust off so you can get that thing to move. Like that's what this activator is doing. Instead of
Yeah.
going through and adjust, I'm just trying to get some micro movements, like you said, stimulate the Golgi tendons,
Hmm.
try to get. So the visual I give them is I'm just knocking the rust off so it's easier to move it. And
Yeah.
that makes sense to people. They're like, oh, okay,
Yep.
it's doing something, not a lot, but it's
Yeah.
doing something.
That's the farm boy coming
Uh,
out in you, man. Not too many people have knocked off rust, man. That's good. Not in Orange
right.
County, but I understand what you mean. No,
Yeah,
no, but that's a good analogy. I like it. Yeah, yeah. I call it clearing out the cobwebs or knocking off the dust. Yeah, it's good stuff. That's a great. I like that. I'm going to use that.
for sure. Um, Man, well, I'm glad we got to talk about the stinger issue because I am going to talk to this client tomorrow, Saturday. Today's already
Perfect.
Friday. Wow. Before his Sunday game, I won't get hands on him before the Sunday game, but it's the last game of the season. They're trying to solidify a playoff seed, so hopefully there's more games after this week for him. So from afar, like we do sometimes, I'm trying to give him a few things that he can do, whether it's stretches or using the portable ARP wave. Just asking him to ask the trainers on the team to do specific things like, hey, see if you can get some anterior release, see if you can get some body work that's going to traction your neck.
Yeah.
So I appreciate the insight. That gives me some food for thought, and
Yeah.
it also reminds me of yesterday was my first day back in the office after a few days off, and somebody came in that hadn't been in a while, and I saw their name on the schedule, and I said, "Hey, I was thinking of you when I saw your name on the schedule. I was thinking of you." And she said, "You think of your patients outside of the office?" And I said, "Yeah, all the time.
Yeah.
Like, what? It's not just my pro athletes. Like,
Yeah.
sometimes I look and I'm like, man, we did such and such with so and so. I wonder how they feel, or I wonder what we can do next time." And yeah, I mean, reflecting on the work that you've done, I think, is important to, assess what you did and reflect on what you need to do moving forward. So I'm appreciative of having somebody that I consider an equal to bounce these things off of.
Yeah, me too. I was thinking, it just popped in my head, like, we constantly think of cases when you're talking about that helmet to helmet, that kind of jarring motion. Got me thinking that's the
Yeah.
motion of like that turtle tuck stretch we do, right, where we keep the eyes horizontal
Yep.
and we just pull the head straight back. And part of that, the main thing with that is it's actually working on those multifidi muscles, which the multifidi are kind of interesting muscles because when they contract, they actually decompress the area. They pull the spine away from the disc. So if it's so bound down and it
Interesting.
hits that and he goes bolt back and they don't really contract, but they fire. If we can work on doing like 3 to 5 of those every time he's in front of the mirror or as a pregame warm up to kind of decompress that, it might give it a little more. When it does happen, it's just an automatic decompression versus a compression. I would also,
Right.
things he can control, that nerve floss where we reach back, pull the hand back, fingers back, and then tilt away to get that plexus to pull through,
Yeah.
floss it through on a regular. Those would be two good game day or pregame or pre-workout stuff he can do on his own too. Just popping in my head. I'm
The
sure.
nerve flossing.
Yeah.
Yeah, that's great, Dustin. The nerve flossing is super effective. I showed a high school pitcher just a
Yeah.
few months ago, and this was actually not even in the office. And he texts me and he's like, "That really worked."
Nice.
And you always like to hear stuff like that, but it makes me think I did not suggest that or put him through, those nerve flossing movements the last time I saw him. So that's something that I can easily break down via FaceTime and have him
Yeah.
do maybe tomorrow.
You know, you just said it's something I didn't put them through. Students listening and anybody like, docs that aren't in the heat of it or in the trenches, they would be thinking like, man, he missed so much stuff. He missed this. It's like, bro, you don't even understand when we're in there and
Yeah,
and we're on the clock and timer. Your adrenaline, you're like playing your Super Bowl each player.
yeah,
And it's like you have to triage and figure out, I only have so much time. I got to take his mentality into play right now too, because you don't want to say the wrong thing
yep,
that's going to set them off before a game. You don't want to put anything in their head that something's wrong, right? It's not a clinical setting.
sure,
So I love when people like judge on game time. It's a totally different experience. It is not, even if it's the night before or the
yeah.
day before, it's still prep for a game, and it's not your clinical setting. So so any of those haters out there that want
I'm
to
gonna,
bash on us for missing things or doing it, it's not, we're not missing anything. Our knowledge base is strong and we're there. It's just you gotta pick and choose what you do in a moment. It's kind of like a pit crew, right? You see the NASCAR cars come
yeah,
in
yeah,
and these guys run in, they all have their job and it's specific to the point and move on. Get in, get out, right? And that's what we're doing. So,
yeah.
so I love it.
In this
That's the
situation, it
exciting
was
part of what we do.
no, it was fun, man. It was well, one, it's great to see a friend, see a client. They flew into town, to play a game. They're from out of state, and so it was good to connect. But you're right. I went to the opposing team hotel, set up. I was in the treatment room, so there's other athletes getting treatment from like the team staff, and I'm not team staff.
Yeah,
I'm brought in individually. So there's a little bit of hello, hello. I'm not stepping on your toes. I'm
yeah,
just over here doing my thing. You want to be respectful of their space and respectful of their procedures and not be in the way. And while all that's going on, I'm like, how's the family? How are you feeling? What do you want to work on?
Yeah.
What is a priority to you? So he's telling me what's bothering him. I'm doing the exam and I'm finding other things that are significant. But like you said, you don't want to put a negative thought in. It's like, okay, well, we can work on this later. This is 2 hours, 3 hours before game time. Let's get his body right so his mind's right. But yeah, I always reflect on those things just because you could hit 90% of it. And then I think it's always good to kind of just go over what you did and see what maybe you missed or what you could improve.
Yeah.
It's I rarely feel like I've had a perfect treatment session.
Right.
I always feel like, man, I could spend 10 minutes more and get that extra juice out of it. Sometimes you do everything right, you get a perfect adjustment, the guys jump up and they're like, I feel great. Let me hug you, dap you up.
Yep.
I feel great. I can't
Yeah.
wait to,
That's cool. Yeah.
and those are awesome too. But sometimes you have a little more complex situations. And so, yeah, that's a good tip, Dustin. I'm going to bring that up to him when I speak with him tomorrow. And then hopefully he has a good game on Sunday and can kind of push through it since he's not feeling 100%.
Yeah, well, you know what part of that psychology is, what I've seen with a lot of these athletes when I'm working pregame, like, because a lot of times I'd be brought in, like, and we're minutes before games, right? And I'm working on people, and
Yeah,
and that's what I'm, in the locker room with them, and a lot of it is, and that's why a lot of these teams would use me, is to have a different perspective. So just the fact that you'll come to him and be like, even if it's over the phone or FaceTime or whatever, and be like, hey, this is what I want you to do. It's something we haven't done, but it's going to open up, and you go deliver it with confidence. And this is what it's going to do, regardless of how you feel. This is what it's doing. Just in their mindset, they're
yeah,
like, perfect. I'm doing something new. I'm not doing the same old shit that we've been doing. Cause that's
yeah,
what typically, and it's just the nature of sports medicine. The trainers, PT, everybody gets in the same rut, not rut, but just we have a routine of what we do, right? And so it's kind of the same game day. Okay,
sure,
put the hot
sure.
packs on. We're in the cold tub. We're doing whatever our pregame is, and it's just the same. So the brain goes into autopilot, and it's just the same. Well, when somebody's dealing with an injury, and if it's one that they're not really bringing up on a regular to the trainers because they're just dealing with it on their own, mentally they kind of, man, I just need something different. I need something different. So when you could be the guy that's an independent or somebody that's brought in to be like, hey, this is what we're going to do. We're going to switch gears a little. This is going to open it up. And again, I always say, regardless of how you feel, that's not what we're trying to do. I'm trying to restore function for you, and I'm opening this up. So I know it's going to work to do that. However your body wants to respond, that's up to your body. And because remember, it wants to protect. So
Sure.
the body's working the way it wants to do. We're just hoping that it starts realizing that it doesn't have to protect the whole time and start letting you function. And then they're like, okay, then you
Yep.
start going into a game time mode with them from a health care, and then they get fired up, right? And they're like, yeah. So
Yeah.
that's half the
Yeah.
battle. If
Yeah.
they feel like it's going to do something, then they're like, I got this. This is good. Thank you, P.
Yeah.
Thanks, P. So
Yeah. No, that's awesome. It's great when they jump up and they're like, "Man, I feel great. Like, I
yeah,
feel great. Let's go.
yeah,
Let's go. It's game time."
yeah. That's fun.
That fires me up too.
Yeah,
I'm hyped on those days.
yeah.
So, well, man, we're approaching the time mark. I know you got patients in the office, as do I. So, is there any last thoughts before we sign off for today, bud?
No, I think we got a lot of good content. I mean, obviously we could talk about tons of different things, but a lot of it's just repeat, same kind of injuries we've seen over the last couple of weeks, with ACLs, different things. If we had the time, it'd be nice to
Yeah.
talk about those and kind of go over some more things, but maybe for another one, because guess what? There's going to be more ACL injuries, unfortunately.
Yeah.
There, one thing I did mention in the little pre thing I sent to you, in scouring the injury report, it's always interesting this time of the season. You start seeing illness being a factor in the injury reports, where in the early part of the
You're
season,
right.
because it's a different part of the year, right? But now we're seeing these guys get run down a little. They're at the tail end of the season, obviously, and they're getting beat
Yeah.
down physically, mentally, emotionally, they're just getting tired, so they're more susceptible. And then
Yeah.
I always say between October and February, we're more susceptible because there's more sugar in our diets to feed the bugs that are around us. And so people are getting more sick. So,
True.
so it's kind of interesting. That was something that stood out to me more as I'm scouring each team. There was almost every team had two or three people, not every team, but had two or three individuals that were listed as illness as part of the reason they were out. So, and yeah, so just
Dude, great point.
kind of something interesting that people don't think about as sports medicine taking somebody out of the rotation and plays a factor. These guys get sick. A lot of them play through illnesses, especially just when it matters. But we've all heard stories of Kobe, Jordan, all these players playing through big fevers and stuff and having some of the best games
Yeah.
they've ever had. Well, it's not always easy to do in other circumstances. So it is a factor.
No, it definitely is. I had somebody come in that I just saw yesterday, and I said, "How was everything? How was your break?" And she said she visited family on the East Coast and came back, and she said, "I'm worn down from the travel." And she was asking if I was traveling this weekend with the Chargers, and I said, "No, we have a home game. We're playing the Chiefs in LA. Every game's a road game because I'm either going to LA or
Yeah.
I'm headed out of town if I go." And she said, "Man, I never thought about this, but those guys that traveled, they must really feel a type of way too." Like I said, "Yeah, that's why if you fly to the East Coast and you have a 10 o'clock, a 1 o'clock kickoff on the East Coast, that's 10 a.m. for us. It's like if you're used to lifting weights in the evening and one day someone wakes you up at 6 a.m. and says, go lift weights, it feels weird to you.
Mm-hmm.
It feels like your body's not used to it,
Yeah.
And so we were just talking about that and just talking about travel and being on a plane and a hotel and how that can just wear you down. It's not something that we think about playing fantasy football. We're like, our guy has to go.
Yeah.
You don't
It's
think
not
like,
good.
man, he traveled across the country, could have had a shitty night's sleep in a hotel room,
Well, yeah.
all these things. So yeah, it's multifactorial. It's a good point you brought up.
Yeah.
Well, man, have a good rest of your Friday, brother. It's the end of the week. I'm glad the weekend is here, and I hope you have a good, productive day in the office. It was good to stop by the office and
Yeah. That was
see you
fun.
there the other day. I
That was
appreciate you
rejuvenating.
carving out some time.
Yeah. I hope we can do that more. That was rejuvenating for me. Really liked you guys having
Yeah.
there. It was good seeing Kelsey and, you know, maybe on another episode we could talk about vertigo, dizziness, and motion sickness if you're up for it. I wasn't going to
Yeah.
bring it up, so we can
I'm
table that for another conversation. But
man, we'll have to bring that up for next week because
yeah,
I'm just now feeling better after I had a little Disneyland escapade. For those listening, we'll talk about that next week, maybe.
yeah, my daughter was there. Oh, yeah, my daughter was there yesterday, and I had to share the story with you before she
You
went.
told her?
Yeah, so
Yeah.
I said, "You stay away from her. Be
Was she
careful."
laughing?
Yeah, so she was good, but
Yeah.
I'll tell you all about her experience. Man, she had a VIP experience that I've never heard of. So, and she's been with me with
Ah,
Kobe and Gigi going, and we had a VIP experience for those Disneyland. This thing was right up there with that yesterday. I was happy for her, so I'll share that with you maybe offline.
oh, that's cool.
Yeah,
Okay, well, I'm going to make a little note here, and we'll talk about that next week for
yeah,
sure on the podcast because I thought what you shared about the your trip with Kobe to Disneyland was super interesting. Kelsey and I were talking about that on the drive home, and yeah, our audience might like to hear that too.
yeah.
So I'll make a point to bring that up next week.
Those are fun stories, fun memories.
Good, man. Well, have a good rest of the day, bro.
You
Have a
too.
good week, and we'll touch base over the weekend about next week. Okay, we'll chat soon.
Sounds good, brother. Have a good one.
Awesome. Thank you guys for listening. We appreciate you. Tell a friend if you enjoyed today's episode. We're trying to grow our audience. This is a Second Opinion Sports Medicine podcast. I'm Dr. Dhokal,
I'm Dr. Glass.
and we are signing off. We'll be back with you guys in a few days. We appreciate you. Be safe and have a good day. Good night.
Good night.